not all, but most children have minor symptoms when they catch COVID-19. Many are even asymptomatic. But within a month after mild or no symptoms at all, children can develop a serious illness called multi-system inflammatory syndrome. While rare, the disease was first reported in South Dakota in a child in June. KELOLAND News has learned that approximately 15 children have ended up in Sioux Falls hospitals with the frightening illness. Most were treated in intensive care. In tonight's Eye on KELOLAND, Angela Kennecke introduces you to one of the youngest patients hospitalized with this syndrome and why his parents say it's so important that people be aware of the symptoms.
2.5-year-old Henry Frichte is back on his northeast South Dakota farm and back on his bike. But last month, this was Henry in Avera McKinnon's pediatric ICU unit. Henry is typically a picture of health, but he got sick fast.
Super uncomfortable. Really didn't want to be touched.
Henry's parents thought it may have been an appendicitis or meningitis. They took him to the doctor 4 times in 1 week. Their last trip was to the Brookings emergency room. Henry was then sent by ambulance to Avera McKinnon in Sioux Falls, where he was diagnosed with multi-system inflammatory syndrome.
Henry, they said, was the 4th case that they had at the hospital.
It doesn't just attack kids that have bad immune systems. I mean, Henry's never been sick, which I think was a blessing for us that we took him in a lot because we just knew something was wrong.
This is a completely new syndrome. So we are still learning about it. The body just goes, just haywire.
The body gets itself prepared to fight this viral infection. And in doing that, it gets, in a way, over-prepared. And as it fights that virus, it, in a way, attacks itself.
In Henry's case, his parents suffered mild cold-like symptoms from COVID-19 in mid-October.
Our kids did not get sick at all, at all. And so we thought, nothing of it.
But 1 month later, Henry developed his severe symptoms.
The little ones that do get sick, they get very sick. And we just don't know who is that going to be.
Avera McKinnon, as well as Sanford Children's Hospital, have seen their share of cases. It typically starts with a fever.
And then you can see a lot of abdominal pain, belly pain, vomiting, diarrhea. Some children can have rashes on their chest and belly. Usually they're pretty tired.
Most children, like Henry, recover quickly with IV treatments and steroids. However, there can be complications. Out of the nearly 1,300 children who've had the syndrome nationwide, 23 have died.
And the heart seems to be giving us the most trouble. There's inflammation in the heart, and most of our kids are needing to get transferred to the ICU, and they're having difficulties with, managing their blood pressure. So some of them are needing to be on blood pressure medications and medications to help the heart. So that's been the biggest challenge.
We will start children on aspirin too, and that's just to help prevent blood clots too. With this big, with the body sort of overreacting to this viral infection, there is a small risk for clots.
The syndrome also affects more minority children, mostly Hispanic and Black.
We do worry about it affecting the Native American population. However, we have not seen that yet.
In Henry's case, his doctors will be following up with him to make sure there are no long-term health issues.
Are you worried about any long-term effects?
That's a great question. Don't know yet. We have to see how these kids look some, months, maybe years down the line.
As each day goes on, he kept getting better and better. And I would say this week, again, he's running like normal, and he's got his strength back and everything. So
yeah, sense of humor back.
Yeah.
Henry's parents never imagined one of their children would get sick like this, which is why they wanted to share his story.
We really need to talk about it more, because the earlier you catch it, the less chances you are of having any long-term effects from it. I mean, I would have never thought that our healthy 2.5-year-old would be one that got a rare disease and is part of a learning experiment for the world. Yeah. So it's kind of crazy, but we do want to spread awareness about it.
While the South Dakota Department of Health tells us only 1 case of multi-system inflammatory syndrome in children has been reported to the state, Sanford and Avera told us they have had at least a half dozen cases each. We also asked Monument Health in Rapid City if they had any cases in children, and were told
that the health system does not disclose that information.